The impact of choosing an inexperienced doctor for dental implants can be so profound. For over 20 years, we've set the standard for expert dental implant surgery and prosthodontics, restoring confidence and beautiful smiles. Each week, we delve into why expertise matters, providing essential insights to answering your questions. Join us to learn how to avoid the common pitfalls and ensure the best outcome for your dental health. Let's begin. Good morning, everybody. Dr. John Willardsen here with Memo Hea, and we've got a great live stream put together for you guys this morning, and thank you all for watching. Last week we had some technical difficulties and we did not make our live stream, so we apologize for that. So Memo, how's your week been?
Week's been good, and we talked a little bit about the week off camera, and how it works good. We have a lot of work, especially with the Trust Aesthetics that we started, and then everything else that we like to do. But yeah, other than that, it's been great. Grateful, we're healthy. We have work. Our families are good. And honestly, I think that's all that matters, right?
Yeah, definitely. In fact, that's a good lead in to have a little spiritual thought. Maybe kind of like to start off with that. As I work on patients and I get to know different individuals, and they come to me really for a specific problem, but a lot of times this problem it affects everything in their life, and what I find is it's neglect is ultimately the ultimate causative factor for patients that end up in my office, anyways. So, and it can be stress, life here, but it's not neglect of maintaining or cleaning or hygiene. It is neglect of just the wear and tear and the structure of the mouth. And so now here's a case where this is neglect of hygiene, just not maintaining it at all and completely giving up. So, and as I see these cases, I think about, what are the things in my life that I'm neglecting? And, and we have our physical bodies, we have, our mouth, clean, maintaining our teeth, our physical strength, going to the gym, working out, our mental strength, reading, and then our spiritual side. And it's important that we keep balance in all areas, right? And if there's somehow, which is a challenge, it's not easy to maintain balance in all facets of our lives. And then you've got your families, you've got your relationships, work. It can be a real challenge and struggle to maintain all of these things. And so one thing that I had this last week was a good friend of ours who they were friends of ours that my kids grew up with their kids. They were neighbors when we lived, about 60 miles away out in Redlands. So they're a family that we were neighbors there. We moved to Newport. They ended up moving to Newport. They have 3 boys that are all exactly the same age as our boys. And so they've all just kind of grown up together, and the mom actually goes to our church, and the dad didn't. He for whatever reason, he never was baptized, and so he wasn't a member. But this last weekend, he made the decision to get baptized, and the only reason I bring that up is because he's making a conscious decision to address and to maintain that spiritual side of his life. And man, what an incredible thing, because I could see him in an instant almost change. Like once he made that decision, it was, and I was at the baptism, and when he came out of the water, it was, I'm just going to share this scripture here. It says, "For behold, my brethren, it is given unto you to judge, that ye may know good from evil. And the way to judge is as plain, that ye may know with the perfect knowledge as the daylight is from the dark night." So it's as simple as, from the dark to the light. It's as easy to judge good from evil with that. For behold, the Spirit of Christ is good to every man, is given to every man, that he may know good from evil. Wherefore I show unto you the way to judge. For everything which inviteth to do good and persuade to believe in Christ is set forth by the power and gift of Christ. Wherefore you may know with a perfect knowledge that it is of God and that it is good. So, so as I was kind of witnessing this whole, in fact, and then one of our other friends, he got married. So all of these are all things, that are addressing and maintaining our spiritual health, right? So like one of my son's other friends, a friend of ours, their son got married, and so he's addressing his spiritual health and his health with his wife. And then our friend who got baptized, he's addressing his spiritual health and his relation with his Father in heaven. So all of these things, we can know that they're good. And inherently, regardless of politics and that, we innately know what is right and what's wrong and what's good. And so that was kind of a thought, that I had. And so when if we can somehow find a way to find balance, and the mouth for me is very representative of somebody who's just kind of given up, but that's okay, because I can fix it. I can help them, and by the time they get to my office or that I meet them, they're on the journey or the path to start to repair that thing that they've neglected for so long, because subconsciously they know that there's neglect. They know they can. I mean, the way that it feels, the way that it works, the way that it functions, it's not functioning anymore. Then the pain sets in, and then infection, and then gum disease, and the whole thing starts to kind of fall apart. So,
yeah, doctor, I actually want to add to that, because I agree with you. I think I was watching a video last night about that same thing. How there's things in life that get broken, right? Like in this scenario, like the mouth gets broken,
right?
In relationships, trust can be broken, and the analogy that they use there is that they use the example of 9/11, right? When that happened, you can't go to 9/12 and try to build it up right away. It takes time to clean up and then rebuild, and it could be better, but it's a process, right?
Yeah, right.
So like kind of how you mentioned, like our spiritual health is, if someone's spiritually broken, like there's a way to fix that through Jesus Christ, right? That's what we believe, but it's not like right away, or with the mouth, right? That's why we don't preach here teeth in 24 hours, because it's a process. Same again with that example is, you can't go from 9/11 to 9/12 and then, okay, let's build it all right up. It took, years. You got to clean up, you got to find the people, you got to do all that. But what it got to is that, like, there's always hope. It's kind of like there's always hope. Same in relationships, right? If there's some sort of trust broken, you can always build that. It's going to take a lot of time to regain that trust. And I don't want to say things will never go back to the same, like in this, in their mouth, but they can get as close as, they were before, but I think even better because of the process of what was learned. Exactly. You know what I mean?
Right. Yeah, and that's a good point, because once we take them from, where they've, where their teeth are just broken down, kind of, the mouth is really struggling, it's suffering, and when we get them back to where they're restored, they really do appreciate it more. And I think this goes across the board. Once, like you said, you can't go from 9/11 to 9/12. I mean, it's taken, and we still haven't really recovered from that, right?
Yeah.
And it changed our lives completely. I mean, everything, on 9/10, when you went through the airport, it wasn't that big a deal, but on 9/11, 9/12, man, and then COVID, same thing. I mean,
to this day.
Yeah. So, and then it's just, how do we navigate through life with the new environment and the new situation? So when patients, after they've kind of reached a point where, okay, I know now my mouth has to be fixed and corrected, and they get it done. Now they have to change that habit so that they don't fall back or lose what we've now restored. Because the restoration is really important. And I'm not just talking about teeth, but just, the restoration and trust and faith and hope and function. Once that's restored and once you feel that restoration come back, then most of the time you want to maintain it. You don't want to lose that again because you felt what it feels like to have lost it, right?
Exactly.
So it is, it's interesting to me because it really, what I see in the work that I do, it truly represents and is indicative of a lot of different things that are going on for patients in their lives, and it's really it's amazing because once we do get patients and we finish their cases and restore their mouths, they are very great.
Like anything that's worthwhile, it's not cheap, nor it's easy to get, right?
Exactly.
You have to work for it.
Right.
And just like in a procedure like this. But thank you, doctor. I do have some viewer questions, unless you have something else to share.
No. I mean, I got plenty, but keep me on focus here.
Okay, sounds good. Yeah.
I get easily distracted. I'm like a goldfish,
I think with phones and social media and everything, I think it's all of us nowadays.
It's brutal. Yeah, like it really is. My phone's like getting messages and
yeah, because that's the thing with what the marketing is. The most powerful way is video, and you have to be really good at catching people's attentions the first 5-10 seconds because everyone's attention span has decreased so much. So yeah, it's
and because you're so good at marketing, like that's what you do and you've learned a lot too, I think, over the last 5 years or 4 years. And think about how much we're being marketed to, like you say. I mean, now there's so many means to be marketed to on our devices and television, and everywhere we turn there's an ad. But what is the most effective way to market, or you know what I mean, like, or what are some things that you will click on, or you will kind of will entice you into whatever you're being marketed?
Well, to be honest with you, the most effective would be clickbaiting and lying. It's unethical, but it's the most effective.
What is clickbaiting?
It's,
For those that don't know.
Yeah, you're offering something so appealing that people just have to click and try to get the offer. For example, like, teeth for cheap in 24 hours. That's kind of we know that's been a clickbait for a long time because even patients, they go to these places, but what they're trying to do is they want to get you in. So that is the most effective. And there's people that sell, online courses, and you can rent a Lamborghini and a mansion, and it's just whatever is appealing to the eye, right?
Right.
I would say that's the most effective and unethical, and that's why we try to avoid that. I think the most effective ethical that's not you don't get the results right away, but it's way better and long-term is just educating and building value, right? And which is what we try to do here, because at the end of the day, we've always said this, a confused mind is always going to say no, right? So you have to, at least what we try to do here is create the awareness and
with a clear message that people understand.
Exactly, clear message. We keep educating, but then also I feel like nowadays with so much information, it really comes down to us. Like we have to do we have to find the truth ourselves, right? Because you're gonna get ads or pages on Facebook or Instagram from like one side of the spectrum and then another one from the other, and you're gonna be like, well, what's truth?
True, yeah.
And it really is up to you to go in and look things up. And again, I just say that because we see it here work. I mean, the patient that you did surgery yesterday, he came all the way from Atlanta because his mom was, she's a dentist, right? Sister?
His dad was a dentist, his sister's a dentist. A whole bunch of family members are dentists. Yeah.
Exactly. And so he was the one, ran into our content on YouTube, saw the value, he's been, telling us that he's been seeing these live streams. He kept doing his research. He even said he went to Mexico to go check it out because it's cheaper down there. Yeah. And once he did his research, he was he flew all the way from Atlanta.
Yeah, he
you know,
did, yeah.
So I think that is, well, to me, ethically and like the best way and most effective way to do it is
Yeah.
just by really
Telling the truth.
telling the truth. Yeah, and just saying like, you find out the truth for yourself.
Right.
It's kind of like what the spiritual side of things that we
Mm-hmm.
teach. It's like, here's this, but you find out.
You have to find out for yourself. And the patient yesterday. So, and I'm flattered and honored that he would come from Atlanta. And we have patients that come from all over the country. But it does a couple of things. It's now, once that patient signs up, it is my responsibility to ensure the most ideal, effective result and or plan to get them to the finish line and have their mouth restored, restore function, restore aesthetics, restore hygiene, like have everything restored to the most ideal and given their situation, so that this problem can now be behind them. So when they fly from Atlanta or Wisconsin or wherever, I do this for all my patients, but I feel an incredible sense of gratitude, but also the pressure is on because I have to deliver. Like I cannot not deliver the goods on these patients, which I do. But whereas a lot of times if you fall into like a clickbait ad and you just end up down the street at a dental office that now is doing implants or all on fours or teeth in a day, and I mean I'm sure they have a high ethical conscience, but if they're doing it or they're just starting, it's just too complicated of a procedure to dabble in or to not take seriously. Every single patient, every single case I have to take very seriously because I'm affecting their overall, their life. I mean, every morning or every time they wake up or when they go to bed, they think about or feel or know what's going on with their mouth. So it's an honor, but it's also a huge responsibility.
Yeah, I'd imagine. Well, we kind of got sidetracked. That was on me, but let's move on to that question that I was talking to you about. This was from 2 weeks ago because last week we didn't have our live stream, and it's about Trust Aesthetics, which we just launched. And the question is, what are all the services that we will be offering with Trust Aesthetics? All
right, yeah. So Trust Aesthetics, and just kind of back up a little bit, and why and how did we come up or get into this? So. When I do a restoration where I'm restoring somebody's, face, mouth, teeth, and rebuilding, technically, like we're talking about, almost, I don't want to say their lives because I'm not, but in a sense we are, because their mouths have been affecting their life for a long time, and so when I have a case like that and we reconstruct their mouth, now it kind of falls, they start looking for other things. They start looking at, facial aesthetics, under eye hoods, over the eye hoods, the skin treatments. They start looking at away from their mouth now and at other things. So there's two things. One, we provide skincare treatments with radiofrequency microneedling, microdermabrasions. We provide CO2 laser skin resurfacing, Botox fillers, which is wonderful treatments. But it's more, for me, it's just kind of the cherry on top. After we've done a major restoration of their mouth, it's just one more little feature that I can add to really complement the whole, because the invasivity of the procedures that we do, so extracting their teeth, grafting, implants, reconstructing their mouth, it's moderately invasive. Whereas the procedures for the like the dermal procedures, and we're doing microneedling, it just really have this glow to them. And when their teeth are done and their skin is glowing, it just adds that much more of a benefit. So and I call it, we have dental hygiene where they got to maintain their teeth. And this is just dermal hygiene. This is just taking care of your skin and making sure and this goes for everybody. And it's not just the 18 to 40-year-old females. I mean, we have patients, like 65-year-old males that are doing this and finding really beneficial aesthetic, they feel better about themselves. That's ultimately the goal. So.
Yeah, well, and also I think it's perfect for what we do here because, like you said, if we see this every day that when patients have neglected their mouth, more likely they've neglected other things.
Right.
Kind of what we talked about is you're not just disciplined in one area. It just kind of reflects in everything. So it could be, skin or other things like that. So once they get their teeth, it's like, what am I trying to compare it to? Is we always talk about cars, so I'm just going to talk about cars. Is, you get the truck you always wanted, and in a way is not enough because now I'm going to order a lift and bigger tires,
some rims on it,
and from metal bump. And you know what I mean? When I see it's like they got their teeth, so they're so excited. So it's like now I'm going to take care of my skin, right? If there's like acne scars, so it's they have that momentum going to just really invest and feel better about themselves, I would say.
Yeah, they do. And that's what I love about it because it does continue their journey in improving their overall health, their overall well-being, and how they feel about themselves. In fact, we do offer semi-glutides as well. And why? Because, I'll have patients that they will finish their case and then 6 months later they've gained like 40, 50 pounds because now all of a sudden they can eat, and they can eat the stuff that they haven't been able to eat for 25, 30 years. So that's another added value that we can offer so that we can help them to, again, be their best selves and achieve their most ideal, overall aesthetic for given their situation.
Yeah, of course. Well, and then just to add a little bit, doctors, we've talked about this multiple times, but it's aside from the looks, the aesthetics, right? Like looking good, being able to eat whatever, looking presentable, it's just the psychological effects that it makes in your mind. Like, we were talking about the book that I was reading called The Expectation Effect, right?
Mm-hmm.
With how powerful our brains are. And then just them...
expecting, remind us again what the basis of the book, The Expectation Effect.
The base of the book is basically the power of your mind, of like when you like kind of like the placebo effect. How nowadays, whenever they're coming up with some sort of new medication, like whatever you want to, some sort of like a ADHD medication or anything like that, when they're doing studies in people, like they grab 50 people. They have to do different separate studies considering the placebo effect, because if I just give you a
sugar pill,
and say, hey, this is whatever for ADHD, this is Adderall, our brains, our minds are so powerful that the effects of Adderall are going to take in place when there's no, you know what I mean?
When you just took a sugar pill, you didn't take
Exactly. So it's like, let's say it could kind of work the same. It's like you tell someone, oh, you already have a perfect smile and you have great skin, and they never look at themselves in the mirror. They're going to act like they have a perfect smile and perfect skin. But again, if they really do have it and then they can see it, it's not only an expectation, but it's reality. So it's their whole mindset shifts. And so now they're way more motivated, happier, wanting to not only take care of like their smile or skin, but just their health overall.
Overall well-being, right?
Yeah, it's like they're leaning more towards like the whole side of things, and that want to do, lose weight, do all these other things. So
I like that you mentioned that, because the hope is the key, right? Just because when they were in a state of hopelessness and they had this going on, this feels and looks hopeless, right? It's like, what do I do, and how do I even resolve this? But once they, end up, starting the process of restoring it, and they can feel what it feels like to have that restoration begin, and then when it's all done, well, the hope actually starts when we first meet, because then they know, you know what, yeah, we can fix this, and it's, we just have to overcome a few hurdles, the time and all the stuff that it does we got to take to get this job done. But the hope restoration process begins in that moment. And so as we go along and finish the case, and once we've delivered, now they can really see and feel what that feels like to have now something that's so important that they've lost now restored. And so then with Trust Aesthetics, we can just continue with restoring any other areas of the face and neck to continue their journey. And so it's a great thing.
Yeah,
and it works so well. The Silpherm X, which is, and we have multiple devices. We have the Agnes, we have the Silpherm X, we've got the Scarlet, and radio frequency microneedling is incredible, and it works so well on all skin types. It doesn't matter if you're, really pale Fitzpatrick 1, which is like redhead, or Fitzpatrick 6, which is a really dark complexion. So, and it's everything from 1, 2, 3, 4, 5, and 6. So, whereas like a laser, you can't use on even a 4, 5, or 6. You have to be very careful because lasers attract to dark skin, so you can burn the skin with the laser. So this is not a laser. We do have CO2 laser here, but also I love this device because it can be used on all skin types, and it is so incredibly effective at treating melasma or pox. Like if you had acne in the past and you've got like divots in your skin or pox in your skin, redness, telangiectasias, which are like blood vessels that are kind of protrusive, and so many different things that it treats. And it's because after we treat the skin with the RF microneedling, and then we put on either PRP or exosomes, which penetrate into the skin, and it just gets that collagen stimulation, and it works so good. It's fun to do, and it's great to see the result.
Yeah, and then one question, and then right after the question, we can take a little break and then move on to the topic of the week. But how long or how many sessions until someone starts seeing results?
On the first session, you're going to feel and you're going to see results right away. But for the most optimal results, it's about 3 sessions, or it's 1 session per decade, ideally. So if you're 44 sessions, 55 sessions, 60, so on and so forth. So, but after the first session, you'll feel the results and you'll see the results because your skin just starts to glow, and you get rid of a lot of blemishes. Like I said, the vascularity is improved. If there are any like blood vessels that are standing out, it's going to get those or target those. So, because some patients you'll see they have like red areas on their face or on their cheeks. That's telangiectasia, and it'll target those and get rid of them. Or like I said, the pox, the divots in the skin post acne or something. And it can be acne from 20, 30 years ago, but the skin surface texture is just not totally smooth. And this completely smooths the surface texture of the skin. So
that's awesome. That's great. I'm glad we're offering it. Might have to try it out myself. All right. Well, let's go ahead and do a 1-minute break, water break, and then we can move on to the topic.
Sounds great. Yeah.
For more than 20 years, we've been the #1 choice in Southern California for dental implants, thanks to Dr. John Willardsen, our founder. We're experts at making dental implants that fit you perfectly using the best materials. Don't be let down by false promises elsewhere. With us, you're choosing dependable, top-notch care. Start your journey to a bright,
For over 2 decades, Trust Implants has led the way in dental implant technology in Southern California. Founded by Dr. John Willardsen, our clinic has transformed smiles with thousands of successful procedures. We prioritize premium quality and a tailored approach for each patient. At Trust Implants, we deliver on our promises, ensuring unmatched results and the highest satisfaction. Rediscover your smile and confidence with us. Schedule a free consultation, in person or virtually.
Welcome back, everyone. Thanks for staying tuned and waiting and for that water break. Now we're going to move on to the topic of the week. 2 weeks ago in our last live stream, we talked about, or we showed a video of Dr. Andrew Heverman, who's actually in this last few videos been focusing on oral health quite a bit, which I am glad that he's doing, because it really is the start of everything. Right?
Yeah, it really is. So, in medicine and in dentistry, they're kind of divided, right? And so, but what that does is it almost divorces the mouth from the rest of the body. And I'm glad to see Dr. Heberman bring it back together and bring it back into the body, because obviously it's an essential part of our overall well-being, our overall health. And if we get into, I was thinking about this on the drive or pre-live stream. So, our mouth, it's called the stomatognathic system. The stoma is a hole, basically, and then gnathology is the study of teeth and how they function. So the stomatognathic system, which is a system it's an organ like, your pancreas or your liver, it has a function. And when there's disease in that organ, the functionality is decreased. And because it is the beginning, the stomatognathic system is the beginning of the digestive system, because that is the beginning of our digestive system, when it's broken, it affects our overall digestive health. And we won't go into Dr. Huberman's video much, because it's, he goes into kind of some basic stuff. I mean, some of the things he talks about is, when is it best to brush and floss? If you're only going to brush once a day, when is that? And that's, of course, when you would go to bed. And why is that? Because if you were to brush your teeth only in the morning and not brush them again until the following morning, what the bacteria, the plaque, the streptococcus that lives in the bacteria, it turns, and even the carbs that you eat, or if you've eaten, let's say you've not eaten any sugar at all, ultimately, if you ate anything that had any bread in it or carbs in it, that's going to turn into sugar. And so if you go to bed and not brush your teeth, and you let that bacteria just sit in your mouth and harbor on your gums, your teeth, in between, think of all the little facets and divots and areas that bacteria can work down into. Under the gum tissue between the tooth and the gum tissue, bacteria works its way down in there, and if it just sits there, it's going to change the pH of your mouth, and it's going to become a very acidic environment. And that's precisely why we see, like when we look at, for example, when we look at this case, you'll notice all of this debris collection. It's just built up, and then around it, the tissues are very red and inflamed. You almost see like a red line following the contours of this gum tissue. That red line is inflammation. And so the bacteria is just sitting there, and and our bodies are so remarkable. It's the body's way of trying to eliminate the bacteria is pulling away from the tooth, which is periodontal disease. So as the gum tissue pulls away, the bone pulls away, and it's the body's way of trying to extract or eliminate that causative factor of this, inflammation. And so now if you remove the inflammation, or you remove the causative factor, which is the tartar and the plaque and the buildup, then the tissues will kind of retract, the pH will change, it's back to